This is Professor Emily Mercuri, and this is Chapter 3, Sources and Bodily Effects of Drugs from Essentials of Pharmacology for Health Professions, 9th edition. Chapter Objectives for Chapter 3. Upon completion of this chapter, the learner should be able to 1. Identify the 5 sources of drugs. 2. Contrast systemic and local effects. 3. Define the pharmacokinetic processes as they relate to the passage of drugs throughout the body. 4. State conditions that may decrease the effectiveness of each pharmacokinetic process: absorption, distribution, metabolism, and excretion. 5. Discuss several variables that can affect drug action. 6. Define various adverse drug reactions. 7. Describe the various routes of drug administration. Any chemical substance that is ingested or applied with the purpose of affecting body function is referred to as a drug. So I want you to think of that as your overarching kind of definition for this course. In earlier times, many of these substances were found in nature. Plants, berries, bark, leaves, resin from trees, and roots were considered a prime source of drugs, and these things are still useful today. Minerals from the earth, including sulfur, iron, potassium, silver, and gold, are also helpful and utilized to manufacture drugs. If you think about indigenous cultures, people around the world have been using folk remedies for hundreds and hundreds of years. And again, many of these things, there are derivatives of them that we are still using today. And some people still practice folk medicine, and it can be very effective. Synthetic manufacturing, genetic engineering with advanced technology has opened the door for in-depth research and experiments, bringing forward effective and safe drugs and the ability to treat illness and discover cures for current medical problems. We'll see on the next slide different sources of drugs, but research led to the use of substances from animals as effective drugs, and substances lacking in the human body that can be replaced with similar substances obtained from the glands, organs, and tissues of animals. The following table has some sources of drugs and some examples of them. So the first column here says plants. An example they give is cinchona bark, trade name quinidine, which is classified as an antiarrhythmic, helps with cardiac dysrhythmias. Another example they give under plants is purple foxglove plant, trade name digitalis, which is cardiotonic. It helps to increase the efficacy of the heart as the pump of the heart. Gives it strength when it's pumping, and it also can help slow the heart rate. Another example they give is poppy plant. Derived from the poppy plant, the drugs morphine and codeine that are analgesics, help with pain. Under minerals as a source of drugs, we have magnesium. Trade name drug made from magnesium is milk of magnesia, which works as an antacid and a laxative. Zinc, trade name zinc oxide, works as sunscreen and skin protectant. Gold, auranopin, can be used as an anti-inflammatory used in the treatment of rheumatoid arthritis. Another source of drugs could be animals. So one example is the thyroid gland of animals creating a thyroid hormone that they are able to use for people who need replacement of their own thyroid hormone. Then we have the synthetic category. This means that they were created. Example is meperidine. Trade name is Demerol, used as an analgesic. Diphenoxylate. Lamodal is the trade name. It's an antidiarrheal. Cotrimoxazole. Trade name is Bactrim septra, and this is an anti-infective sulfonamide used in the treatment of urinary tract infections. And the last source of drugs we have here on this table is genetically engineered DNA drugs, hepatitis B vaccine, insulin growth hormone. So hepatitis B, Recombavax HB vaccine. A lot of times vaccines are created from DNA so that we can actually target what we need to target within the body. They are typically made from a deactivated version of the viral source or the infectious source. Another example is insulin, trade names Humulin, Novolin, those are anti-diabetic. And then growth hormone, Neutropin, that is classified as a hormone. Knowledge check. Vaccines are produced from which drug source? A, plants, B, animals, C, synthetic, or D, genetic engineered? And the answer is D, genetic engineered. So when we're talking about effects of drugs, I want you to think of systemic versus local effect. Systemic, think body system, solar system, right? So this larger entire system is being affected. So in a systemic effect, it reaches widespread areas of the body because the medication reaches the bloodstream and is then carried throughout the body. So for example, if you take Tylenol for a headache, even though your purpose was taking it for a headache, if you have knee pain, the Tylenol might help with that as well because it's going throughout your entire body system. Local effect, on the other hand, is limited to the area of the body in which the drug was administered. For example, if you're using a topical cream, let's say a Benadryl cream because you are itchy and you have hives, it's only going to work on the area in which it's applied. If you put Benadryl on your left arm, your right knee might still be itchy, right? Because we're not targeting the system, we are using the medication on a local area, localized, it's kind of just right there in the area that it was applied in. Knowledge check. Examples of a systemic drug effect versus a local drug effect includes all of the following except A, limited to the area of the body where it was administered, B, affects a widespread area of the body, C, carried throughout the body, D, reaches the bloodstream. And then the answer on here, it says A, limited to the area of the body where it was administered. So they worded the question wrong in the second slide, but which of these is not an example of a systemic effect? A, limited to the area of the body where it was administered, because that is an example of a local effect. Let's talk a little bit about pharmacokinetics. When you see a big word like pharmacokinetics, I want you to break it down into smaller words that you're familiar with. So pharmaco, I want you to think pharmacology, think drugs. Kinetics, movement, kinetic energy. So putting those words together, pharmacokinetics is the process in which a drug moves throughout the body. When a drug enters the body, it undergoes many changes along the way. There are 4 drug processes through which the drug undergoes these changes, so I want you to be aware of these. One is absorption. So absorption means the passage of the substance through a membrane into the bloodstream. Think about a sponge absorbing, where the water's moving through the sponge. So the drug is moving through a membrane, some kind of body membrane, depending on what type of drug it is. Is it going, is it sublingual? Is it getting absorbed directly through the membrane in the mouth? Is it being swallowed? Is it being absorbed through the GI tract? There's many different ways, but absorption, think it's passing through a membrane into the bloodstream. Distribution, it's moving from the bloodstream now into the tissues and fluids of the body. So it's in the bloodstream, it's going throughout the body, and now it's moving into the tissues and fluids of the body. Metabolism is physical and chemical alterations that the substance undergoes in the body. So as it is moving through the body, what changes are occurring both physically and chemically. And then excretion, eliminating waste products of drug metabolism from the body. How does that happen? Is it through the urine? Is it through the stool? Depends on the medication. This slide here is going to dive more into each process. So the primary site of absorption is the mucosa of the stomach, mouth, small intestine, or rectum. Blood vessels in the muscles or subcutaneous tissues or dermal layers. So what that means is it depends on where the medication's given, right? So if you are swallowing it, the mucosa of the stomach and the intestines is where it's going to be absorbed. If it is a suppository, if it's going in the rectum, the mucosa of the rectum is where it's going to be absorbed. If it is a shot, the blood vessels in the muscle or tissue is going to absorb the medication, so on and so forth. So some conditions that may alter this process: incorrect administration may destroy the drug before it reaches the bloodstream or its site of action. For example, certain antibiotics, if you give them right after a meal instead of on an empty stomach, the metabolism that's occurring of the meal can actually alter and impact the absorption of the antibiotic. The process of distribution, the primary site that this happens is through the circulatory system, capillaries and cell membranes. The medication travels through those and into the body. Some conditions that may alter this process is poor circulation, meaning impaired flow of blood. So the drug won't be able to reach tissues where it's to have its desired effect if there's poor blood flow in that area. For example, maybe someone has very poor blood flow in their feet and legs, and so the painkiller never really makes it to that part of their body and they're still in pain. The process of metabolism. The primary site of metabolism is the liver and the small intestine. So some conditions that may alter the ability of the body to metabolize include hepatitis, cirrhosis of the liver, damaged liver, so the medication may not break down adequately, and this may cause a buildup or accumulation of unmetabolized drugs. So that can be really dangerous. If the normal person can break down, let's say Tylenol, which breaks down in the liver, and excrete it, but somebody with liver failure, they can't break it down, and then the Tylenol can build up to toxic levels in their body. And then excretion, the primary site of excretion is the kidneys, sweat glands, lungs, or intestine. So some conditions that may alter excretion, renal damage or kidney failure may prevent the passage of drug waste products, and again, that can cause an accumulation of the drug in the body. So there are different variables that will affect how quickly or successfully a drug goes through the body. And if any of the four processes are altered, the drug action and effect will also be altered. The site of absorption varies according to the physical properties of each drug. So in terms of absorption, pH is important. So drugs that are acidic in nature are going to be absorbed well within the stomach because that environment's super acidic. But alkaline drugs are not going to be absorbed well through the stomach. They're going to be absorbed in the more alkaline environment of the small intestine. Lipid, fat solubility. Substances high in lipid solubility are quickly absorbed through the mucosa of the stomach. Alcohol-contained substances are soluble lipids that rapidly absorb through the gastrointestinal tract, whereas substances that are low in lipid solubility are not absorbed well through the stomach or intestinal mucosa, and are absorbed best when given by means other than the GI tract. So other than the GI tract, meaning you're not taking it in a pill form, maybe it's a shot. And then presence or absence of food in the stomach. Food in the stomach tends to slow absorption due to slower emptying of the stomach. If a fast drug effect is desired, an empty stomach will provide quicker absorption. Some medications on an empty stomach are contraindicated though because there are some that irritate the stomach and food helps them to not cause that irritating effect. Movement of a drug from the bloodstream and into the tissues and fluids of the body can also be affected by specific properties of the drug. And reaching major organs may depend on the drug's ability to cross a lipid membrane. So when we're talking about distribution, some drugs pass what we call the blood-brain barrier to reach the brain, some do not. Some drugs have actually selective distribution, which means they have an affinity or attraction to a specific organ or cell. An example is amphetamines have selective distribution to cerebrospinal fluid. So amphetamines really only impact cerebrospinal fluid heading up into the brain. Amphetamines work directly on the brain. Metabolism. So when transformed in the liver, drugs are broken down and altered. Sometimes they create like water-soluble byproducts with that alteration, and then the drug can be more easily excreted by the kidneys. Some drugs, however, are actually inactive when administered, and they become active only when they are metabolized. This group of drugs is known as prodrugs. It is possible for some drugs to bypass the process of metabolism when this occurs. So when drugs bypass the process of metabolism, they reach the kidneys pretty much unchanged, and then they show up in the urine. So they will show up in a urine detection test, or certain things like certain vitamins might turn your pee different colors. And then for excretion, most drugs are excreted by the kidneys via the urine. It is possible that some drugs are eliminated through the lungs and exhaled gases and anesthetics, or through perspiration, sweat, feces, which is poop, bile, which is vomiting, or breast milk. If a drug is not excreted properly before a repeated dose is given, the drug forms a buildup in what's called a cumulative effect. A cumulative effect means there's an increased effect of a drug that's demonstrated when repeated doses accumulate in the body. If too much of this occurs, toxicity will happen, which is a condition that results from exposure to either a poison or a dangerous amount of a drug that would normally be safe when given in smaller amounts. In drug therapy, the goal is always going to be to give just enough of the drug to cause the desired therapeutic effect. It's important to know that there are other variables that can affect the speed and efficiency of drugs being processed by the body. One of these is age. So metabolism and excretion are slower in older adults. As I shared, there's often a caution for certain medications for patients over 65. On the flip side of that, children tend to absorb things much more quickly, and things can also react in unexpected ways. So it's important to be mindful of that when giving medications to children as well. For weight, generally the bigger the person, the greater the dose, although this can vary. And sometimes there are medications that are calculated by body weight or by ideal body weight to get the correct dose for that person. When we're talking about gender, I'm going to kind of switch this to biological sex. So we're talking about biological women versus biological men. Biological women respond differently than biological men to some drugs. So the ratio of fat per body mass differs, and so do hormone levels. Also, if someone is pregnant or nursing, drugs should be selected that are safe to use for both mother and child. Psychological state. So positive patients have more positive responses. It's actually been proven that the more positive a patient feels about a medication, the more positive the physical response. And this is actually referred to as the placebo effect. So you might have heard of these drug trials where someone's given a sugar pill, but they're like, yeah, it works so well, and they actually start to see improvement. It's because they have the thought that will work, even if the medication is not actually doing anything. But this also goes for medications that they are taking the correct medication. Their thought and positivity about the outcome of that medication actually can impact what happens within the body, interestingly enough. And then drug interaction. So taking more than one drug at a time or, in your daily regimen may alter the normal expected response. I talked about potentiation and how you can actually make the drug have a stronger effect, but you can also kind of have like a canceling out effect where you limit the efficacy based on the other meds that you are taking. And then dosage. Different doses of drugs may change the speed and effectiveness of each drug. Dosage can bring about variations of a drug such as speed, action, or effectiveness, and dosage is defined as the amount of a drug given for a particular therapeutic or desired effect. The minimum dose is the smallest amount that will provide a therapeutic effect. The maximum dose is the largest amount that will produce a desired effect without producing toxicity. We always want to think about what is the minimum therapeutic dose. So what is giving the patient what they need without going over that? Because there's something called the law of diminishing returns. Essentially, let's say I take 200 of ibuprofen, 200 milligrams of ibuprofen, and I don't feel anything. My pain's still there. But I take 400 milligrams and the pain goes down to a 0. Well, even though for my body weight, I can go up to 600 milligrams in one dose, there's no point. There's diminishing return, meaning it's not really making any difference when I go from 400 to 600 if 400 milligrams is already doing what I need. So we want to go for the minimum therapeutic dose. The maintenance dose of a medication is the dose required to keep the level of a drug in the blood at a steady state to maintain the desired effect. And then a toxic dose is the amount of a drug that will produce harmful side effects or symptoms of poisoning. And then a lethal dose is a dose that is high enough to cause death. So the therapeutic dose is going to be a dose that's customarily given and adjusted according to variations from the norm. So an adult dose based on a body weight of a certain amount of pounds, etc. Knowledge check here for you. What is the correct process in which drugs pass through the body? A, absorption, metabolism, distribution, excretion. B, absorption, distribution, excretion, metabolism. C, absorption, excretion, distribution, metabolism, or D, absorption, distribution, metabolism, excretion. And the answer is D, absorption, distribution, metabolism, excretion. Knowledge check. What best represents selective distribution? A, eliminating waste products from the body. B, attraction of a drug to a specific organ or cell. C, drugs broken down to water-soluble byproducts. Or D, passage of a substance through the bloodstream. And the answer is B, attraction of a drug to a specific organ or cell. Another question. Which is not a common factor that can affect drug action? A, hair color. B, height. C, weight. D, psychological state. Answer A, hair color. Routes of drug administration. The route of administration of a drug is actually the most significant factor in the speed of drug action. There's a number of methods that drugs may be given to reach their destination, but we're going to split this into two categories. So enteral or GI tract routes, and then parenteral routes. So under the category of enteral or GI gastrointestinal tract routes, oral medications, also known as PO, from the Latin per oris, which means by mouth. So oral PO medications, nasogastric tube, NG tube, and gastric tube. So what an NG or a gastric tube is, it's a tube. If it's NG, it goes through the nares of the nose and down into the stomach. If it is a gastric tube, it's surgically inserted through the abdominal wall, and the medication goes directly into the stomach. And then the rectal route, or PR per rectum, that's when a medication is inserted directly into the rectum, still in the enteral tract. And then when you look at parenteral routes, there are injections, so intravenous, like an IV, intramuscular, like a shot that goes directly into the muscle, subcutaneous, intradermal, intracardiac, and that is medications that are obviously not going directly into the gastrointestinal tract. And then under this route, they also put a list of standalone meds, also called non-parenteral, which is like sublingual, transdermal, so something that goes on the skin and it gets absorbed that way. Sublingual is under the tongue, gets absorbed. Topical, directly on the skin as well. Ophthalmic in the eye, otic in the ear. Transvaginal in the vaginal canal, nasal, and then inhalation. There is a picture here of IV drug administration. So when you start an IV, that goes directly into the vein. That's a very fast route. There are advantages and disadvantages of the different administration routes, of course. Think about giving a medication in an IV versus by mouth. One is much less invasive, but it's going to give the medication to them more quickly. So the physician will decide the route based on the desired effect, the absorption qualities of the drug, and how the drug is supplied. Other general points to remember is oral route is the easiest, but the effects of an oral medication are going to be slower because of the time required for the dissolution for that to metabolize in the GI tract. The intravenous route is the fastest. It enters the bloodstream immediately. Parenteral routes are chosen when a patient cannot take a medication by mouth or the drug is not suitable for GI absorption. So we talked about how some medications aren't going to do well in that environment. So that might be given through a shot, for example. Intramuscular route is rapid. The muscle of the body, it's highly vascular, meaning it has a lot of blood flow. And intramuscular may be an option if the intent is to slow the speed of absorption. So let's say, for example, someone is requiring a pain medication, like an opioid, and the choices are intramuscular versus intravascular. We might choose the intramuscular to kind of slow down the speed and let that kind of lengthen the time that the medication is in the system. The transdermal route allows for a slower, consistent drug absorption over time. So sometimes you'll see things like a patch, like for example, a nicotine patch if someone's trying to quit smoking, and that allows for slow drug absorption over time. It's kind of like a time released. And then inhalation is fast acting because the lungs actually have a large surface area and rich blood supply. And when I think of inhalation meds, I think what comes most easily to mind is something like albuterol that is inhaled during an asthma attack to kind of open up the lungs. That's going to also be fast acting. So knowledge check. The oral route is the fastest and easiest method of absorption to administer a medication. True or false? The answer is false. Oral administration is the easiest. However, the absorption effects are slower because of the time it takes to dissolve the drug. Intravenous route is the fastest as the drug enters the bloodstream immediately. So let's talk about adverse drug reactions. Unintended effects of medication are known as side effects, and they can come in many forms. So things like cough, pain, tremors, headache, dizziness, light sensitivity, lab value changes. When harmful side effects occur, it's termed as an adverse drug reaction, and many times a change in drug dose or frequency is needed to prevent this. Here's some terms I want you to be aware of in this table. The first one is teratogenic effect, and that is an effect from a maternal drug administration causing physical defects in a fetus. So when given to a pregnant individual, the teratogenic effect means that this drug can cause the baby to be born with physical defects or cause the fetus to have physical defects, and that could even lead to, death prior to the birth. And so this is a really important thing to be aware of, and this needs to be labeled on medications if they are known to have this effect, similar to that thalidomide that we talked about in an earlier lecture. An idiosyncratic reaction is a unique, unusual, and unexpected response to a drug. So this drug doesn't usually have this effect, but this person is 1 in a million and they had this kind of weird idiosyncratic reaction. Paradoxical reaction is an opposite effect from what's expected. So for example, someone was given something to sedate them and then they got really agitated. And, this can happen with certain conditions or certain med interactions. Tolerance means a decreased response to a drug that develops after repeated doses are given. So the body builds up what we call a tolerance and the drug is no longer effective. Dependence is, relying on a medication, the body is depending on it, and it can produce physiological or psychological symptoms of withdrawal. So let's say, for example, someone's on a narcotic. If they are on that frequently and then they aren't on it anymore, it can cause symptoms of withdrawal, including nausea, tremors, sweating, pain, retching, vomiting, that kind of thing. Hypersensitivity reaction is an immune response to a drug, can be mild with no immediate effects, but it's more likely to exist in patients with other known allergies. Let's say that someone has, for instance, an allergy to eggs and they're given a medication. Even if it doesn't have a derivative of that, it can cause this immune response because they already are sensitive to different agents. And then anaphylactic shock, severe and possibly fatal. This is a true allergic reaction. Signs of anaphylactic shock can start out mild but quickly become severe, including itching, hives, vascular collapse, meaning the blood stream, the system starts to shut down, shock, difficulty breathing, swelling of the throat, that kind of thing. And these are very serious. These are going to require an EpiPen, which we'll see on the next slide. So this right here is a picture of an EpiPen, which is utilized to treat severe allergic reactions. And these are prescribed to patients who has a severe allergy that they may be exposed to unintentionally. For instance, a bee sting, peanuts, that kind of stuff. It's important to educate the patient as well as the family on how to use the EpiPen. It goes in a straight downward motion directly into a large muscle. It actually can be administered through clothing, but ideally, it just goes directly onto the skin itself. And we always say blue to the sky. So the blue side goes up, the orange side goes to the thigh. Is usually the muscle that we inject in, and you just simply push it down and you'll hear a click. It's also important to know if someone uses an EpiPen, there is this rebound effect. So it has a short half-life. The medication can wear off really quickly. So if someone has a reaction that warrants the use of an EpiPen, you still need to go straight to the hospital, call 911, because when that medication wears off, they could have a rebound and even have a worse effect from their allergic reaction. Another knowledge check. Cyanosis and dyspnea are associated with which adverse drug reaction? So cyanosis, just so y'all know, is blue discoloring around the mouth, indicating lack of oxygen, or around the fingertips. Cyan, blue, cyanosis, they're blue coloring. And dyspnea, I want you to think of as like pneumonia, so breathing, and then disordered or ineffective, so dyspnea, difficulty breathing. So cyanosis and dyspnea are associated with which adverse drug reaction? A, tolerance, B, paradoxical reaction, C, anaphylactic shock, or D, hypersensitivity. And the answer is C, anaphylactic shock. Your self-assessment for this chapter: can you explain the advantages and disadvantages of each drug administration route? What are the variables that can affect the speed and efficiency of drugs processed through the body? And can you describe the 4 processes related to the passage of drugs throughout the body? This has been Chapter 3. Thanks for listening.